happen now immediately.
No.
Is it going to happen for sure in 6 months' time?
I would absolutely hope so.
Okay, so there's nothing wrong with the policy, it's just a question of the failure to communicate properly.
Well, it is amazing that something that has the potential to transform the way we look after patients, something that has been signed up by the major patient charities in this country, and one of the only parts of the Health and Social Care Bill that the RCGP agreed to, is having such bad press. My sense is it's caught up in the age of mistrust. It's caught up in a lot of noise that's going on around it, such as the mistrust happening around Snowden. And actually, it is something that is very positive, that will help deliver better patient care and better health services.
Well, why have you so signally failed to communicate that to the public?
And I think there is an issue there. Of course there is. And I think there has been some failure to communicate this. But as I've said, if I was to look at how we can do this again, which actually we are going to do, we need to have a re-look at it, a re-look at how we're going to inform the public of the benefits of this programme, and actually start working with some of the patient organisations that are concerned about this to highlight the real benefits to all of us.
You admit you messed up the communication?
I think there has been an issue. I think there has been an issue with communication, Jeremy, but actually, and dare I blame the press, I think you have taken...
Why blame the press?
I think you have taken, not you personally...
I haven't had one. Laura Koonsberg. We can have a poll of all the technicians in the studio if you like.
I think when we get on the front page of major newspapers that the police are going to get access to your data, that this information is going to be sold to insurance company, that it's going to be sold for commercial purposes, I think it's misinformation.
Can you give a guarantee it'll never be sold for commercial purposes?
It will be illegal to sell it for commercial purposes.
So there's no possibility of it going to drug companies?
It depends what drug companies want. Drug companies can have access to data now. If a drug company puts in, if a drug company puts in an appropriate research protocol, they have a legitimate reason to look at this. But we're not talking about drug companies to do it to then sell you drugs, to drop on your doorstep a drug that you don't want.
My question was whether it could be sold to drug companies.
It will not be sold to drug companies.
Right.
But if you ask, could a drug company have a legitimate use for information in monitoring long-term medications? Yes, of course.
Private healthcare providers?
Private healthcare providers will not get the access to this data.
All of them?
Again, if a private health company wants to put in a legitimate research protocol that goes through the ethical and legal framework that anybody else has to, then they may potentially have it if they want to do something.
So commercial entities will potentially have access?
Commercial entities will not have access to this data in order to start selling you products, to drop, as you mentioned with the pizza, to drop advertising material on your desk.
No, that's you. You're the people who've done that.
Neither will insurance companies, neither will the police. This is for legitimate reasons that for the first time in the history of the NHS will bring together data that's collected by myself in my practice with hospital data.
All right. The other thing that people are concerned about is precisely how easy it would be to identify them. David Davis has already cited one case. He's had his nose broken 5 times. Match that up, number of people in the country with 5 times broken noses. Not very many, 100 or so.
I think, yes. I mean, if you want to take
Match it to his diphtheria vaccination, you start to get a picture.
Everybody's had diphtheria vaccination, so I'm not sure how, you wouldn't... If you're asking diphtheria vaccination at your date of birth, again, it'd be incredibly difficult to identify.
Will people's postcodes be disclosed?
The way this information will be, as your report said, it will be sucked up into a central computer system. Postcode, NHS number will be taken up into a centralised system in order to link it with the data that we have already in hospitals. But if you want to use it for research purposes, which you will have to go through proper ethical and legal processes, that data will not be identifiable. It'll be what's called pseudo-anonymised, scrambled up, and the only way you'll have is scrambled up data.
When you look at an organisation like the National Security Agency in the United States, the most highly classified secrets in the world, and yet still a man can get in there and publish them wherever he likes. We can't have any confidence in these assurances you're giving.
Well, you've had it for 25 years. and you've not
Oh,
had...
so you can do a better job of keeping secrets than the National Security Agency?
Well, fortunately, it's not my job because I don't understand computers, but for 25 years, there hasn't been a breach of information to the level that you've just been describing in the National Security Office.
Do you know how many serious data breaches there have been in the last 2 years?
I've been told, I do know, because it was on the front page of a major newspaper.
Yeah, what were you told?
Many of those data breaches were...
What were you told?
I think there was something like 2,000 a day, if I remember rightly.
2,000, 2 million a year.
Yes, and the vast majority of those...
2 million between start of 2011 and now.
The vast majority of those, the NHS unfortunately now needs to keep up with the times. The vast majority of those were notes being left on the backs of cars, data sticks, computers with information not encrypted. What this is about is a safe, secure, legally binding system held within the information centre, which, as I've said up till now, has not had a data breach.
Thank you very much.
Thank you.
Now, what's wrong with whales? If you wanted to keep a mouthful of teeth, it didn't used to be the sort of question you asked